Okie doke. So this week's session we are going to cover medications, and particularly I want to focus on, because by the look of this we have a lot of nurses in the room as well, but I also want to go through the medication administration wizard, which is our barcode scanning. But I'm just looking around. There's my scanner over there, and I'll show you some of the barcode scanning. Do you guys have scanners out yet? Have you practiced with us? We'll show you some.
They're attached to the back of the warehouse, but that's it.
I don't go anywhere without my trusty scanner, so let me just... Okay, apologies, I'm back. All right, so let's start off with a bit of an overview. So hopefully most of you have seen this all before, but anywhere you had your papernymic chart or your national inpatient medication chart, which is what we're all used to now, is now replaced with a digital system. Okay, so where you can administer medications from is the medication administration record. So that's what you're looking at right now. This is the MAR. And this replaces that paper sheet. And then there's another tool that I am going to show you, which is particularly on the administration side for nurses as well, to speed things up. So we'll go through both, and I'll talk about when you use which one when. Okay? No worries. So let's start with the MAR. Now, your orders will all come through and be face up on the MAR. So this is your order here. Underneath it, you will get the indication. So your indication, remember when we talked about orders, for those of you that were here, when you're ordering medications or when a prescriber is ordering a medication, it is a mandatory field that they put in the indication. Okay, so why is this patient taking that medication? All right, so that now all shows nice and face up, because I don't know if you remember, all on the piece of paper, half the time that box isn't filled out unless you have a really good doctor who fills out those details. That's the only mandatory field there. So we have, so for example, you've got your amlodipine, there's the prescription underneath. And you've got the start dates, when it was ordered, things like those details will go under there. And then you've also got your indication saying that they're on it. Sorry, do we want to turn some lights down? Can you all see that? I don't have my glasses, so I don't know if that's blurry for everyone or just me. That's all right.
What are the GA doctors doing when they get someone that don't know why they want a medication? What do they do then?
Ask pharmacy. Yeah.
Yeah, what if it's after hours?
They will hopefully put in their best clinical judgment then.
Yeah.
Yeah.
Like, for instance, like they're on aspirin, we don't know why.
Yeah.
Maybe preventative, but we're not sure if they've had a stroke or whatever.
Yep.
We don't know,
Yep.
and I want to put in the wrong information. So can we just write continuing?
Probably, yeah. You probably want to use your best clinical judgment based off what they give you. You can always go back and modify it though. So if the best you've got is, you just go with the basic generic hypertension, then you would go back and you can modify it.
And the pharmacist can modify that.
You can modify it, absolutely, yeah. Okay. Damn it, I fell straight into that one. I should have covered the recording. Okay. The other things to note on this page are your tasks. So this, liken this little box over here to your boxes on your medication chart. So where, as nurses or administrator, you go and sign it to say, yes, it's been given. Think of that like that. That's your little task over there. I will go into that a bit further on. So there are ways you can filter out this medication administration record as well. So they are broken up into your scheduled meds. So they're your basic, your normal, your QID, BD, what have you. They're regular medications. Unscheduled medications here, I don't have any to show you, but if you do see an unscheduled medication, that just means that it doesn't have a frequency attached to it. So there's no time that they want it to be given. So think about your post-op. So maybe they'd say, give this medication 30 minutes post-op, or give it, 30 minutes prior to transfer to another hospital. Those types of medications, because there's no drop of a time that it's due, we say that they're unscheduled. So they just float along till you're ready to give them. So when that patient comes back from theatre and 30 minutes is up, then you'd give them. They're not going to go overdue and say, wait, you haven't given this, because it knows that it's just an unscheduled one. That's what that means. Your PRN medications, that's annoying, I didn't put any on. They're nice and green, so same thing. Those tasks will float along. So I probably should have clarified this. So your yellow line here, your yellow column is the time that it is right now. So this one here, the sertraline is saying that I have a sertraline that was due at 14:09, because that's that task they're saying, that one. So if I had a PRN medication, it just floats along in the yellow column, because you can give it, we know, PRNs are as required, so whenever. So we don't have it designated to a certain time, so it just floats along. Wherever that yellow column is saying it's now, that's where the task for your PRN medications. Forgive me, I did not do one. Do you want me to quickly do that now so everyone can see what I'm talking about? Is it a bit confusing? Yeah. I normally have that ready. Apologies. Let's just quickly go through and do your...
When someone's given a PRN medication, does it get locked out for a period of time?
No, so it won't get locked out. So if you've given, especially even if there's a range, it's saying 5 to 10 of endone, and the nurse has given 5 milligrams, if they go to give the next 5, it honours whatever the frequency is. So if you're saying they can have 5 to 10 every 4 hours, they'll still get an alert saying, wait a minute, do you know that this just got given? But you can override it. So if you go, oh, okay, it did just get given, but I'm allowed to give up to 10. So I'll give the other 5.
Maybe 2 hours later for the other 5.
Correct, yeah. But if it's only 5 milligrams every 4 hours, they're still going to get that alert saying, wait a minute, you know that they've only just had this. It'll also tell you that they've just been given. So I'll show you that as well. Let me just quickly, let's do this one. So our PRNs, let's put in our mandatory. Alright, so now I can show you what that looks like. So, there's our PRN medication there. This projector is always a bit, it squishes everything up. Let me just try and do it like that so you can see it a bit better. So see how my now column, there's my 5 milligrams. So as that time moves along, this little task box will also to say that it's there, ready to go, 5 milligrams when you need it. I will show you once I've given that, it also displays there saying last time it was given as another little indication. So we'll get to that. The next one down is your continuous infusions. So think PCAs, NICIs, fluids, everything sits in continuous infusions. All right, and we'll touch on fluids because that's always a bag of fun. We'll do that at the end as well. Moving down further, your discontinued section, so any of those medications where the order is no longer active, so maybe it's a stat dose, they asked you to give a stat dose of something. As soon as you've given that, it drops into grey because it's no longer an active medication. Okay, so really important here is when you first open the system, it's likely that this filter is going to be set on all active medications. You probably want to change that to all medications. I know I would if I was a nurse looking after a patient, because you want to know if they've also had any stat doses as well, because you won't see them because they've already been given. Does that make sense? Yeah, so once you change that once, it's done. It sticks. Yeah. So the first time you log in, you might want to change that one to all medications. Yeah. The next filters we're going to look at, so you've got therapeutic class view. This one's always handy. So if you've got, a patient going to dialysis or whatever, and you just want to look at all their renal agents, or maybe the pain relief, and you just want to see what pain relief they've got, and their MARG is chocker full, some of our old biddies that have a ridiculous amount of medications, you can start breaking them out based on that therapeutic class view. So if we go in and we said, let's look at the analgesics they've got, so we're going into this one, it's just going to filter out the rest and just show you those ones. That's also really handy when we get to insulin as well. So the insulin orders always can be overwhelming at the start when you look at them on your medication administration record. So I find, and I'll show you when we get to Complex Meds Week, you can filter that out to just look at your diabetic agents. Route view is pretty self-explanatory, IV, oral, whatever. If you've got a student with you that can't give IV, you might want to filter it out and say, well, these are all the oral ones that you could give if you want to do those. Plan view, again, we'll talk about this when we get to complex meds. You can see one of the old complex meds I'd had on this patient, so a heparin infusion. So plan view is just all those medications that are included in a power plan. And if you don't know what a power plan is, do not stress because we haven't covered it yet. But in essence, it's just a group of orders. We use them like pathways, and we use them for complicated medications that need a lot of decision support behind them, or they're based off a protocol or statewide guidelines. Heparin is one of those, and insulin as well, but we'll save that for another fun week. Tapering view, so that's all obviously your tapering medications. Prednisolone, for example, so you'll just see them. It doesn't look any different. If you want to, I can put one on there when we finish and you can have a look what it looks like, but it's just got the different tapering doses. Okay, does that make sense so far? How you can filter that all out? All right, let's go in. The other thing I will show you quickly because I like it, if you right-click on this one, I think I've shown you this before, and you go to Reference Manual, you've got your built-in little handy MIMS as well. Okay? So if you've got your student going like, what's this medication? You're like, can't remember. Distract them, look at the reference manual, and then pretend you know what the answer was. Yeah. Just don't tell them where it is or else they'll cheat all the time. But that's also handy as well. All right, so let's go into the part that you probably want to know, which is just how do I give a medication. All right? If you want to give a medication, And just also Care Compass, for all of you that are using Care Compass, all your medications, you probably have seen it in training, all your medications are also filtering tasks in Care Compass. Yeah, you've probably all seen that. Have you all seen that? Yeah? I'm in as a doctor at the moment. Let's do it. Let's change to a nurse. Let's commit. Yeah. Let's jump into Care Compass. So this would usually be your ward list. Oh, no. Oh, so close. So I've been a really bad nurse and I've got 105 tasks due. Oh, no. Oh, no. So all the red ones are saying they're overdue because I've been naughty and haven't administered any of those, but they drop into your task list just like anything else. So if you've got OBS, your task for OBS due or your wound care, medications will also pull into here to remind you. So if you want to look at, again, this patient, someone's been playing on my patient and I've ordered a whole lot of stuff. All right. All right, let's jump down to here. So, and I can tell now who it is because it's got postnatal ward newborn, so I'm going for the midwives when I get back. All right, so at 5 o'clock I can see there's some insulin there. Okay, so it breaks it up for your task list to remind you to help you prioritise your care out there. You can't administer anything from here. You must go into the medication administration record. That is the source of truth for all medications. It's a safety thing, just like we don't have, several paper medication charts out there. There's always, and it's actually even better in the digital system because now we've got all one source of truth, even for your infusion. So you don't have a fluid order form, a PCA order form. It's all on the medication administration record. Okay. The other thing is this will also work exactly the same way. So your little alerts that go around your, did everyone see what I did just then? Your little alerts around that patient, that's saying there's a new order being placed on your patient. So as soon as the doctor goes in and orders something, and I always use the same example, when you're so close to going home and you're like, I'm on the home stretch, let's get out of here. And then some doctor's gone and written a little sneaky span K or something real annoying. You're like, God damn, why didn't you tell me? You know what I'm talking about. This gives you the real-time alert. So this is not saying that doctors aren't going to use their words because they should still come and tell you that they've just charted a medication. However, this is like your safety catch. So if you see that little box appear around your patient, it means there's a new order there. So if I came in, and again, I've been a terrible nurse, so this is saying these are all the new things that have been placed on your patient. It's just like an FYI. So you don't have to do anything from here. What you do is just say, I've reviewed it, so I know. So as soon as you hit that one, that little red box, let me get rid of that for you. That little red box has now gone away. And that means that if that box comes back, I know that there's a new order there. Does that make sense? That's not just for meds, that's for anything else. If they order an IDC removal or, pathology, that box will reappear to say, hey, do you know? Or if they modify something, if they've modified one of your meds or your infusions or you change the rate of your fluids, again, comes back to say, hey, do you know that they've changed that? Yeah? A little sneaky way to jump straight. So if I go, oh, yep, I better go give some medications. A sneaky way to get straight back to the MAR is if you right-click on this one. Your MAR is one of the shortcuts there, so you can click on that one. It's going to jump you straight into it. I don't mind if you don't remember that. Eventually, you'll learn the hard way like I did. There's all these shortcuts in the system. All right, so let's go ahead and give the amlodipine. If you're wondering about some of these icons, the little mortar and pestle there, that just means pharmacy. Haven't reviewed it yet. So you know how pharmacy come along with their purple pen and go, yeah, I've checked all this, I've supplied it, we're all good. The poor old pharmacists don't get their purple pen anymore, heaven for Betsy, so now they get a little mortar and pestle. If that goes away, that means the pharmacist has reviewed it. Pharmacists on their end can also reject orders, and they can also put in interventions as well. So if they look at an order and go, wow, that's really unsafe, they can reject the order. What we'll get here is a big mortar and pestle with a big cross through it. Doesn't mean we can't give it. Doesn't mean we can't give it. I know we're giving a bit of power here. It just means you need to go and chat to the doctor first. With that rejection will also come an intervention power form, and we might do this another day as well, where a little notification goes through to the treating team saying, hey, listen, this is why I've rejected, and it'll give a reason why it might be the wrong dose or they're not even on it. Not that any doctor would ever do that, but it will pop up there. If the doctor goes, I don't know what the hell they're talking about, just go ahead and give it, you can still override it and go ahead and give it. Okay? The non-LAM one? Yep, so that's all in the catalogue as well. When you go into order medications, if a medication is not on Impress, you get a little symbol to tell you that it's not, and it's exactly the same where you would expect the patient to bring it in. What's a non-LAM one that I can think of? I'll show you so as I start typing. There's all the different isomep. Let's see the little triangle, the yellow triangle. So when the doctors are ordering, that's also the first indication to them that this isn't on Impress. Yeah. Your SAS medications or your restricted ones also have a red triangle. So all those ones they need special authority for, they're also got icons beside them so they know.
So doctor will know straight away.
Correct. Yeah. Yeah. All right, let me just jump back out of there. Alrighty, this little icon here just means it's a stat dose. So there is some new terminology here, whereas we're used to saying stat and it's on the front of the medication chart. In the system, it's now. Now means stat, give it now. And it comes up red as opposed to your regular medication, which I feel like someone's gotten rid of, which really is annoying. It will look like this. See how it's just a blue box? As soon as it goes red with black writing and it has a big now, that's your stat dose. If it goes red with white writing and just looks like a normal thing but it's red, that's an overdue dose.
Oh, that's really slack.
That's me. Yeah, that's when you're slack nurse like me. So you get an hour window either side before things start going overdue, because we know as nurses or anyone that administers med, you usually start rounds an hour before and you tend to finish them an hour late because it takes so long to get around to all the patients. So it'll stay blue until that window, that hour window either side is up, and then it goes red.
Does it turn another colour after that?
No. It'd be good if it starts flashing or something. Nah, it doesn't, unfortunately. It just stays there red. But everyone can see that it's red, and there will be outstanding tasks on your care compass as well. Yeah. All right. Let's go back up to, this is the messiest medication record. I'm really sorry. So this now dose that the doctor said, yep, give that amlodipine now. It's easy as clicking on that task. So I go, yes, I'm going to give that one. You're presented with the administration window. And so this is all the details about that medication you're about to give. This is where you might say, amlodipine is probably a bad example, but if, for example, it was, I use always the example of your Panadol, they're charted 1,000, they only want one tablet, they only want one of the Panadols. You know, we'd normally go and say, try and write in that little box, so like, I've only given one, it gets really messy. This is where you'd just change that here. You'd change the dose, say, well, actually, I've only given one of those. Does that make sense? Or maybe, not that you probably wouldn't be doing that with your scope of practice, but you know what I mean. You can change to say exactly what you've given that patient. All right? Let's go back to the 5. The other thing that you'll have on this page, if you've got the date and the time, if you actually gave that medication an hour ago but things got busy, you got tied up, we know it's not ideal but it happens, you can come back and backdate the time to say, well actually I gave that at 2 o'clock. I swears it. So you can come and do that there. The other thing, your witness medications, so all those medications that we have to have 2 nurses signing, this is where you will do that here. Nothing changes with the digital system. It's all governed by your scope of practice and existing policy and procedures and legislation. So if insulin, where we always have your 2 nurse signature, continues in the digital system. Antibiotics, where it's really only a drug check and you both sign the additive label, but you don't necessarily sign the medication chart, same thing. It's all exactly the same as what it was before. Out of interest, do you countersign your opioids or your S8 drugs for 2 nurses on the medication chart?
Yes, we do. Yes.
Okay, so that would continue. Okay, so if you're giving endone, because it varies every hospital we go to. PA, for example, didn't. They never had the 2 nurse, but we've noticed Logan, and now you guys as well. That's a local policy and procedure that you do, so you would continue with that then.
We don't need ED
Oh,
though.
okay, so you don't have to do an ED. Don't worry about it. All right, so I will put in a witness to show you what that looks like. These other details down here are more for your IV type of medications, so you can put in your diluents and everything. So if it was something else, if it was maybe like an antibiotic and I'm going to mix it up and push it, I can say, actually that's a lie, I've been out of the game for too long, say putting it in 20 mils, that 20 mils is going straight to your fluid balance chart. Okay? Or if you're putting it in a little mini bag, you're going to run some, you're going to say, actually, I don't care about budget cuts, and I'm actually going to put it in a 100 ml bag, even though they don't like it. I know. I love the nurses in the room. They get it. Everyone else is like, yeah, and I'm like, no, you have no idea. Yeah, you're writing everything. Chuck it in a 100 ml bag. So that 100 mils, yeah, oh God. Yeah, it's just a new way. So that 100 mils will go straight to the fluid balance chart. Okay. If we go ahead and do our witness, so I can show you this. So usually, sorry, let's go back a step. Usually you just type in the last name and it's really easy. You'd find it and say that's the nurse that's witnessing it.
So
Because
you
I'm in a...
somebody else's
Yes. Wait for it. Yep. I know. I love how you preemptively like, wait, it's okay. So I'm just going to search for a test one, so we'll go this one. So you'd be typed, so that's their name that's gone in there, and the system goes, oh yeah, I recognise that name. When I go tick to sign this off, and this is equivalent to your patient swallowed the tablet, or if in this case we've hung it in 100 mils. So this is once they've had it, then you're signing off. Just like you wouldn't do it, you wouldn't sign the medication chart till they've had or swallowed or whatever, you know what I mean. So we're going to tick that off. This is where it goes, wait a minute, you've said that someone else witnessed this, they need to put in their signature. So that's their password. So where we'd normally do your 2-nurse signature on a piece of paper, the witnessing nurse is putting her password in. The primary nurse who's already logged into the system, your details are already there. It's tracked you down to the timestamp that you're doing everything. So the witnessing nurse just has to put in her password to say, yes, I did witness this medication. Does that make sense? All right.
Do you have to have a witness?
No, so again, like I said, scope of practice. So if it's a time delay thing where it's like an emergency, you can come in retrospectively and you can enter in the witnessing nurse. Yeah, just like I imagine you probably do on the paper as well. If you didn't get that second nurse, it's all exactly the same. Yeah. So let's go ahead. I hope that's the password. That is.
Are there some medications you have to have a witness in the system, or are they?
No.
Yeah.
No, so we haven't made anything mandatory in the system in terms of the administration side of the witnessing. We thought about it when we designed the system, and we thought, this might be a nice idea for your warfarins and your insulins and things like that. As soon as you start to put some limitations in the system, we don't realise, but it has this massive flow-on effect for all those sole practitioners or the smaller hospitals. We learnt that very quickly, so we took it all away and went, use your scope of practice, whatever you're doing now, or legislation, local policy, procedure, and we just review it. So unfortunately we can't flex it per...
We are talking here about giving an endon, for example.
Yes. Yeah.
What about is Miss Strauss away then?
Yeah. I love when this segue is perfect, actually. All right, I'm going to go through that. So I'm going to use my refresh button. Everyone knows they're refresh. So see how it's going tick? You've given that now dose. When I refresh, I'll show you where you see that. So this is probably important for the doctors. If you want to know what they've given, you can see that 5 milligrams was given at 2:30. Okay, the other place that doctors tend to like reviewing most of this is the MAR summary. So I'll just quickly, just for our sole doctor, it's a bit exciting, we never get doctors in here, so we'll just give him a little treat and show him a little something, something. Yes, it will in the... So the MAR summary is, you can't administer from this. Everyone has access to this. Nurses, you can see this as well. But it is exactly what it says. It's a summary. So it puts it into these 8-hour lots. So it's easier to just see what's been given for the day. So doctors tend to like it because the MAR is quite busy and it's quite a nursing domain because you can see all your little bits and pieces and what you've got to go, whereas this one's just at a snapshot. What have they had? What have they still got to have? This also, the beauty of the MAR summary is it is cross encounters. So we've always talked about any orders that you place in the system are encounter specific. So if I place, if there are orders placed on this patient and they're in an inpatient, if that patient presented to an outpatient, you're not going to see those medications. They're separate, right? Just like they would be on paper. This is handy in those instances where maybe they started in outpatients, so on a separate encounter, and maybe they've deteriorated and they need to be admitted now. They need to go to ED because something's happened. This now, when they present to ED, because it's a different encounter to their outpatient, doctors can, or anyone can now see what they've had in outpatients though. Does that make sense? So the nurse, so you won't see it on the MAR, which is where you do all your administrations, because obviously the safety risk there is like crazy because you'd have all these different things from different encounters. The MAR is purely that encounter. The MAR summary will show you across encounters. Does that make sense?
Is that also different hospitals? So a common
Correct.
transferred.
Absolutely, yes. Perfect example. So if you have a patient that comes from Logan, this is where you're going to want to see some of that stuff. Because, MAR summary. Okay. Now, what was it? They spat the tablet out. Yeah. Okay. So once you've given the medication, so you can see here that first of all the last given says there it was last given 5 milligrams at that time, okay? Because if you could imagine if the time's moved along, you may not see that dose there, you may not see that administration, so that's why we have that saying there that that's the last time that was given, just to save you scrolling along to see when it was last given. But if for some reason you've gone, oh no, like maybe they spat out one of the tablets, or, so let's do that one first. They spat out one of the tablets, and so they've actually only had one of it. Or maybe it was an antibiotic where only half of it went through. What you can do is you can actually modify, everything in the system you can modify, okay? And I always say to you guys every week, chances are if you want to do anything in the system and it's just not playing your game, you either need to refresh or right-click. They're your best friends. If you want to change anything, it's always a right-click. So as soon as you right-click, you're presented with these other options. Modify is always the right-click. So if we go back into that, it reopens that box for you, and you can go back in and say, well, actually, you know, they only had half of it, or whatever. If they didn't have any of it, that's a little bit different. I'm going to show you that. So I could say, oopsie, my bad. That's the same way if you didn't have time for this witness nurse. So you'd modify it, it opens it back up, and then you put in your witness nurse in that circumstance that things got busy. Yeah? All right, let's sign that off. That's my witness nurse. So the C means that heads up, that's been modified, and there's a comment there as well. Okay, so it changes to 2.5. If you ever want to see more details, again, right-click, and if you go to View Details, you can get a lot more information here. So it'll tell you exactly what's happened, it'll tell you who witnessed it, who modified it, it gives you the whole history of that administration. Okay, any comments that went with that? So ideally you would have, if you're changing anything, we always as nurses tend to put a reason next to them. So you probably would have written patient spat out half of it. You could just put that in the comments. Did everyone see where the comments were? I probably should have shown you that. Hindsight's a beautiful thing. All right, let me just get out of this. If the patient didn't have any of it, so you need to unchart it. So you don't want it to look like they've had any of that medication. Right click again, but it's an unchart. Okay. Reason needs to go in, so you could say patient refused. Sign that one off. And then it says in error. You'll also notice the task will come back because I've done that. So the task has come back, and maybe you've gone again to try and give them another one and they've still gone, no, I'm not having it. That's when you'd go into this one and you'd say, well, not given. Did that just confuse people? So your not given is always an option down the bottom when you go to give a medication. Just as we know, they always go, no, I don't want that medication for whatever reason, or maybe you've gone to give you antibiotic and they don't have any IV site.
Or if they are nil by mouth. So
Perfect, nil by mouth, so there should be a nil by mouth fasting. There it is. Someone's going to look back at this and go, yeah, but you're giving it 100 mils. Who was this person? I'll blame it on Bodez. I'll go, Bodez a nurse, and I'm telling you, they do some weird stuff out there. So it will say they're not given. Okay, so everyone can see when they go back, oh yeah, it was not given. If you wanted to see at the comment, like we did before, we could come in here and have a look. Nil by mouth fasting. Happy so far? Makes sense? So if anything, now that you've got the electronic record with medications, everything is much clearer and easy traced, or easier to be tracked. So you know with the medication, as soon as one modifies it to an R and then it's like, oh no, I am going to give it, and you end up with these massive ink blots on your medication sheet. I don't know if your doctor's probably looking at, have they had it or have they not had it? What is this? Or what time is that? Everything is so clearly set out in the electronic record. Everything is time-stamped. Everything is tracked. Don't freak out, but it's like Big Brother. People, if we need to, we can find out who gave what. So you can see the safety benefits for the patient as well. Now, if you think about your morning round, and you think, God, if I have to do that for my morning round, and my patient's on 30 medications, so I've got to select every task and go into it and tick it off, you're quite right, and I would also be a bit like miffed if I had to do that. So there is something we call the Medication Administration Wizard, and I'm really off my game today because I normally have a barcode printed out as well, which is really annoying. So this one you should all be familiar with. So as soon as I go to the wizard, okay, so first of all I would be looking at my allergies like we always do. I look at the full list of the medication chart. This is an additional safety tool with the electronic system. Alright, so because I'm in DOH Test Dave's patients chart, and I go to the wizard, it's going to say, okay, well scan his armband for me. If I don't scan his armband, I scan someone else's armband because I'm standing at the wrong patient's bedside because I've just had a hell of a morning, I get presented with a warning saying, that's incorrect, that's not the right patient. If I scan his armband, then it goes, okay, that's the right one, here are the medications they're on. I'm really annoyed that I haven't had this set up. I can show you quickly because I'll scan anything and show you what the warning looks like. So that's what you'll get if you're at the wrong patient's bedside. Okay, it'll go, wait a minute, no, that's not correct. If you go to the right one, ignore this. If I go to the right one and scan, then I get presented with their medications. Okay? Only then will it show you what's due. Now, the whole point about the medication administration wizard is that it filters out all those other medications that aren't due at that time. So if it's 8 o'clock in the morning, what it's going to do is it's going to show you all the medications due at 8 o'clock in the morning, an hour back, so all those medications maybe that are due at 7 o'clock, so an hour back and an hour forward, but it filters out all those other ones. So it filters out your lunchtime ones, doesn't show you your dinner time ones, so then there's no mistake of accidentally giving the wrong medication. It's only going to show you those ones. In saying that, like everything in the system, if it is for some reason the doctor's gone, no, you can give that one early, I want you to give that, you can always change the filters on this. So if you wanted to actually see ahead, right-click again, you're going to go, and this is the same as everything, I think we've done this before in all other areas of the chart. If you ever want to change a date range, and there's that grey toolbar, if you right-click and go to change search criteria, this is the same with documentation, the same with pathology, so everything. You can change it and it will then show you forward. So if you go, well actually I know I shouldn't be seeing that medication, but show me the other one. So now I've got more medications on my more. Okay? Now, there's the same details are there. There's your prescription there from the doctor. Now, it's so messy, but all your medications currently have barcodes on them. Okay? So you just use your stock standard barcodes that you get on your medication boxes. These are all built into the system, and the reason is so we can provide that extra layer of safety. So when you've got your medication and you go, okay, well I've got sertraline due, 100 milligrams, when you pop that out and you say I'm going to give this, when you scan it, what the system goes, yes, that box you're holding matches that order. Okay, that product you've got in your hand matches that order. Correct, that is a good point. So you still need to do all your 7 rights. Now I'm going to show you, so I've got an order for 100 milligrams of sertraline, but this is only a 50 milligram concentration. So normally we'd give two doses, right? So you probably want, what happens when you scan that then? So if I scan that one, what I'm going to get is something saying, well, that's an underdose. Okay, the order is for 100 milligrams. You've only scanned that box once, that's 50 milligrams. If I scan it again, then the order goes, oh, okay, we're okay. That's an exact match. I'm happy. You can continue on. You feel like a bit of a checkout chick, but, you know. Now, the reason I've got 2 there is because I didn't clean this patient up for my last demonstration at Logan, and that's why there's 2 sertralines there. Hopefully that would never happen. And in the real world, if a doctor did order that sertraline twice, they would get a warning saying, you know that there's already that order on the chart. And hopefully you saw that when we did orders, whenever it was. I lost track of time. I feel like it was a couple of weeks ago. So you know that all that decision support. So, and that's another good one, and it will go across and counter that warning as well. So if you've got a Logan patient coming and you go to order something and they just had that one, you'll still get the same alerts firing. It'll say, oh no, wait, they've just had that medication, or that's just been ordered. So those decision support, it's important to note that they go across and counters. It will be, yes, because it will be Bow Desert, so it's all linked to the funding and things like that. Just like it would be if they presented, they'd still have to go back through. Unless it's a direct admission. Nah, that's the same. They still need their same VIN. There's VIN numbers associated, so we can do the barcode scanning and everything as well. All right, so the sertraline one has now presented me with this warning. So it's gone, yes, that's an exact match. But what this is saying is that this medication is getting documented late. Amy, you slack nurse, why is this late? So I have to give a reason. Likewise, if I gave this early, like outside of that time frame, it would say, you're giving this too early, why are you giving it so early? So you do have to give a reason why. Outside of that 2-hour period, remember, an hour back, an hour forward, so you've got like about 2 hours, 3 hours to give that medication. If you're doing anything outside, rightfully so, the system's going to want to know why. And maybe your nurse unit managers. So you do just have to give a reason. There are times when it is applicable to be doing that. So you just select other, and you might say, you know, chatted with pharmacy said it's fine to get it back on schedule, or something like that. Yep, perfect. I'm just going to choose a different one for the sake of this so I can get rid of it. So you'll now notice that that's got a tick beside it, the sertraline. If I want to get to that administration window and I want to go, well, actually I'm only giving one of these tablets, and you want to get to that other window that we were on before, if you double click on the result, it brings that up. So that's when you can go in and do all the same things that you were doing before. Okay, let's get back out of that one. Now the amlodipine as well. Now this will be good because it should show you that we've just given this. If I look like a real druggo here. I like to carry this around the hospital too, so everyone's like, you should just steal all these. Oh, that's annoying. I don't think I have an amlodipine of all this stuff. Is there a thiamine on this chart? Actually, let's show you what you do if you don't even have a medication that's due. This will be good. So, I'm going to scan my thiamine now. Oh, dang. Well, this is good. That's fine. We'll show you this as well. So you're going through, if you've got a lot of medications, you're just going through, you're popping them out, and you're scanning, you're checking the expiry still, because the system can't do that for you, unfortunately. So you're still doing that. So you're going through and going, yes, thiamine. So you keep going through and you keep scanning. If you scan something, surely the patient's not on the kidney vital. Surely this... Or I'm being really slack, so everything's asking for a reason. If you're doing it on time, you're not going to get all those warnings, so don't stress. It's just because I've been lazy. So this one here, finally, it's not on. What that alert is saying is that that scanned medication is not within the medication administration wizard task list. So the patient's not on this. So are you sure you're giving the right medication? Okay, so it's just that extra layer of safety. So you think about it and go, oh, shivers, whoopsie. Now there are... I need to give you your toolbox talks as well. So on your toolbox talks, for those who haven't been to these sessions, you always get a printout with all the key points. I have given you the 5 different alerts you'll get when you're barcode scanning. Okay, so you might get one saying they're on that medication, but it's not within the time frame. Okay, so maybe you're just giving it a little bit too early. So there are lots of different alerts with barcode scanning. So I've put them all on in that folder. I've been so psyched. This is what happens when no one comes with me. I don't do anything right. I haven't even got you to sign on, have I? Oh, God. Okay. No one leave before I get out that sheet at the end, or else I'm in trouble. So there are a whole lot of alerts that come with your barcode scanning, because it's not something we're familiar with. It's kind of weird scanning your medication, so I've included that all in that document for you guys, so you know what are the different alerts that come up. But by using that barcode scanning, you've got that extra layer of safety, plus you're going through like you usually would and going, okay, well, I've given that medication. So you're multi-selecting. So whereas on the MAR we had to go into each medication task on each line and say, yes, I've given that one, you can group sign these off. Okay. If I don't have a barcode, which is probably a question about to come out of one of your mouths because it always does, we have about 90% of the medications in the system do have barcodes built in. You will come across those ones that don't have barcodes, and in that circumstance, it's fine. All you do is you tick. So it's just like you would do normally then. You're just doing your usual seven rights. You're just checking the box yourself. You just don't have that extra decision support to, stop you and wait and say, wait a minute, which is what we're used to. So if you were doing that, you would just tick the box manually. Okay, and that's just saying, yes, I've got that medication in the cup ready to go. Okay, if it's a DD, you're not going to be getting the DD out of the cupboard with the whole box, walking to the patient's bedside so you can scan and then walking back and putting the box in. There's no way I'd be doing that either. So for your DDs and things like that, you wouldn't be scanning. Or anything that's, kept in that cupboard, you're not going to take the whole box out, walk to the bedside, because this is all done at the bedside. If you think about it, we're scanning the patient's wristband, so we're at the bedside when we're doing all this. So this is why we are trying to push for most of your medications that are on impress or the patient brings in, that they're kept in their bedside lockers. And how much of that happens out of interest?
No, it's not.
The packaging?
Our pharmacy won't be doing it.
So, as you said, we don't need barcodes, but they're doing the little brown bottles. We can just not have the barcodes.
It's little brown bottles.
Yeah, we've got little brown bottles that they have, like, for, like if you got frusemide in a bottle of 100, they might have it in.
Oh, I see. Yeah. And you don't have a barcode on it. Yeah, that's right. It's just a patient, like it's designated to that pack. Yep, with you. So, yes.
They won't get it.
Do you do that for all your medications?
No, they have an impress stop within one room, and so all medications are dispensed in a room.
So you can scan
Our
something.
lockers do.
Have we raised this? We'll talk about after. Okay, cool. Well, that's fine. If that's something new to me, so that's fine. I'll talk to V after that. But that happens. That's fine. You guys are the first rural site going live, so we're learning all these weird and wonderful things that happens out at a rural site. So we work around that. That's absolutely fine. But just so you know, at least, if there are some that you've got a barcode for and you want to scan it, by multi-selecting these ones and saying sign, what that's doing is it's signing them all off together. Okay? So that saves you, even if you don't have your barcode scanning, you can still tick the boxes, then that all signs. So if you've given like 10 or 20 medications, rather than having to come into each task here and tick and sign, and you're going through each list, you go to the more and you can just select them all to say, yes, I've given all of those. Make sense? Yeah?
Very much so.
Good. All right, how am I going for time? Fluids. Bum, bum, bum. All right. just as the doctor disappears. That's unfortunate because we want them to be doing this right. So I do have a few little fluids down here, but I'm going to start from the start. All right, the fluids are all ordered the exact same way as the medication, so they're all in the catalogue. So the doctor will come along and go 0.9 sodium chloride. So it's exactly the same in the system as what it is on paper. So one order or one line on your paper infusion form equals one bag. Does that make sense? So if you've got a bag hanging, it has an order. One order, one bag. We don't do, when we took on the system, it's an American product, they do fluids where they're bottomless. So they'll have one order, and when that bag ends, they just hang up another bag and they use the same order. They don't do it the same way that we do here in Australia. So when we built the system, it was really difficult to try and get it to replicate what we're all used to, which is one order equals one bag. We got there. It gave us many headaches, but it is exactly the same. So you'll be happy to know it's exactly the same. If a bag needs replacement, you need another order. Okay? We don't just keep hanging bag after bag. So the order sentences are all in here as well. So based off our usual rates that we use when hanging fluids. So 1,000 ml bag. So the doctor just comes along and goes, well, yeah, I'm going to run this 10th hourly, sure. All your other fluid types are all in there as well. Okay, KCl, everything's in there. So we'll go ahead and select that. I'm in as a nurse. Beg your pardon. Just so we don't get all those alerts popping up annoyingly telling us you shouldn't be doing this, I'm just going to change over to a nurse. In saying that, you can do you guys do your KVO fluids as a nurse initiate? Yep, it's in your nurse initiate folders, it should be. I think it is. I'm pretty positive. Thank you. Excellent. So that is in there, so that is within your practice to do that. And you would just, when that box comes up to say, this is out of your scope of practice, should you be doing, you know that little communication box that says, should this be a cosign? You just say, oh, actually, you are a cosign for nurse initiates, aren't you? I think, is what I heard. Yeah, it's one of those ones. Yeah. So you'd send it for a cosign then. All right. Where's my fluid gone? Oopsie, got a bit excited. All right. What did I say? 10th hourly we're going to do. So it looks a little bit different on the order scratch pad, as we like to say, but you don't have to worry too much about this. It's more the doctors that will get used to this. If they went, oops, I made a mistake and chose the wrong one, they can change this, or maybe they want a weird and wonderful rate that we don't, it's not one of our standard ones. So they can go through and change that one as well. If the bag volume, they went, oh, actually, just hang a 500 ml bag. It's rare that happens, but maybe they did. They can also change those details here. Okay, we go ahead and sign. So because they chose the right order sentence though, so when I went searching and I went, oh yeah, I'll do the 10th hourly one, they don't have to enter anything else, it's all done. So it makes that ordering process very quick for them, for doctors, because all the order sentences are pre-built. So you select the right one, you don't have to add anything. So
your program accounts for your nurse practitioners and the rural.
Absolutely. Yep. So it's all linked to your APRA numbers, so they all have prescriber numbers. So everything in here is Novell based. So as soon as you log in using your Novell, the system knows what you are because it's all linked to APRA. So if they don't have prescribing rights, they're also going to get presented with that window saying, do you need a cosign or not?
Private nurses don't have prescribing rights that they can supply and administer.
Do they have a prescriber number?
No.
So
They're allowed to supply and administer medications.
So would they write them on a medication chart?
Yeah.
Yeah. So they will just do this. So they'll still get presented with that, but they just choose one without a cosign because they're allowed to. Yeah. So they don't have to send it to a doctor because they're allowed to. Yeah. All right. What am I doing? Fluids. Let's jump down to our continuous fluids. So I've got a few bags here, but the one I ordered is the bottom one, 0.9, the 1,000 mils. So it looks very similar. The rates are all there, and then the slight difference is that your task is now just says pending. So it just means it hasn't started yet. You need to start this one. So when I go ahead and select that one, the administration window looks a little bit different than your medications because it's suited to your fluids. It defaults to say this is the begin bag. Okay, so we need to tell the system we've begun this bag. All right. So when I go and say, you have to choose a site. The site is mandatory. That was one of those annoying hard-coded things that we couldn't change, because you'll notice like you're not going to be infusing fluids, or you could be in your scalp, but a lot of these aren't really common, so we can't get rid of them. So the two top ones we've put stars beside because they're the most common ones you'll be using, whether it's a cannula or a central line. Okay, so just choose one of those ones. We say apply. Your witness, so your two signatures, again, it's exactly the same for the fluids. You enter it here, you'll be presented with the password box for the witness nurse. So I'm going to go ahead and sign that. What it looks like is it says that this bag was begun at 14:58. Okay? Nothing is going to the fluid balance chart, importantly. Okay? I need to tell you this, so don't expect because you've begun that bag anything's being documented anywhere else. All it's saying is that if anyone looks at this, they go, oh, okay, that bag got begun at 14:58. All right? I will come back to that to tell you what does go to the fluid balance chart. But the other thing I wanted to point out is this manage infusions section. This is just another nice way to look at your fluids. Again, it's mostly used by our doctor friends. And it will just tell you all the fluids of the patient, and it will tell you whether they're infusing or not. Okay, so you know when the doctor comes up to you like, I wrote that bag of fluid up. Is it up yet? Have you hung it? Is it going yet? And you're like, just go look at the chart yourself. We'll go look at the patient. They can actually come to this section here and manage infusions. There's a little legend up here. If it's light blue, it means it's currently infusing. If it's dark blue, it means it hasn't yet started. Okay, so it's another nice little way for them to quickly have a look or gauge where all these sequences and all these infusions are up to. That makes sense? It also gives them an estimate of when they're due to complete. So you've got your infusion ones that are not... This is so annoying. I assure you, your wows or your monitors that you get out there, your resolution here, you don't have to do as much scrolling. It's just because we're working off a laptop and a projector. So it'll tell you how many hours are remaining on all these bags of fluids as well. So the doctor can have at a quick glance go, okay, well, that's got a couple more hours. Maybe I need to do a couple more orders for them. That type of thing. If I jump back to the MAR, as soon as I've begun the bag, what you're then going to see, so your pending bag stays there because you can do multiple actions on that. You can put your infuse amounts in, which I'll show you. When I scroll along, you'll now notice you have an end bag. So that's the same thing. So it goes, okay, well, this bag's running at 100 mils an hour, which is 10th hourly. So that means that this bag is roughly due to finish in 10 hours at 0:58. Okay, so it gives you that rough estimate. If you start stopping or if you start bolusing, you need to know that that end bag task is only an estimate. Okay, the system doesn't know whether you've stopped that bag of fluid because you wanted to run something else or you put it on pause because something happened. The system doesn't know that. So it won't reflect necessarily what's actually happening with that pump. So you need to know that that's just an estimate of when it should finish. Really, it shouldn't go past that. If anything, it'll finish before that, based off how much you're infusing and things like that.
Can I ask a question?
Yes.
So we've been struggling with, because we've been doing our KBO orders.
Oh, yeah. Yeah.
You know, that's not going to finish for...
No. Great question. Yeah.
So how the hell do you find the end bag?
Yep. Beautiful. Love it. Yes, and then can you remind me to tell you that in a second? I just want to show the infuse amounts, but that is a really good question. So if you want to start saying, okay, do you guys document your fluids by the hour here? So every hour you go, well, 100 mils has been through, or are you more of a bags finished, 1,000 went in? Everyone's a bit different? Yeah, you can do it either way. All right. So if you're doing it by the hour and you're going, okay, well, every hour 100 mils is going through, when I select that pending bag task again, it's now defaulted because it already knows it's begun, so now it's changed to infuse there. So any infuse amounts you put here, this goes to the fluid balance chart. Okay, so you still have to tell the system how much has gone into the patient. Even though you've said the bag's going, it doesn't know how many mils. Until we have pumps that talk straight through to our charts, we won't get that. So you still have to manually go in and say, all right, well, 100 mils went through for the hour. Okay, system, you sign that off. Oh, we apply it first. The reason you apply it doesn't sign off straight away is because you can do multiple tasks here. You could go and say, oh, actually, and plus I did a bolus an hour ago, if you're wondering why you have to apply plus sign. So if I do that one there, and I refresh, it's now saying 100 mils got infused, okay, and I documented that at 15:02. Just to show you the fluid balance chart, what that looks like. Here it is here. No, that's a lie. Sure, there it is. So your 100 mils there, it even says what bag it is. So what, and that's the same with, remember we did I sign off that amlodipine? I did, didn't I? I just want to show you. If you do any medications from the MAR and you say you put it in diluent, remember I said that will go to the fluid balance chart as well? We marked it as in error after that. But if you did put the 100 mils, it will come across and it will align it up with the medication, which is quite nice. So if you give a Piptaz and you say, I put that in 100 mils, then it's going to say Piptaz 100 mils, rather than on our fluid balance charts where we just write IVAB or what have you. Does that make sense? So your fluid balance charts start to get a little bit more accurate and specific. All right, so that's your... so only your infuse amounts and your bolus amounts will go to your fluid balance chart. Everything else, your rates, don't go to the fluid balance chart. And if you, whenever you're wondering about, and you're like, why isn't that appearing? Just think back to your paper form, because sometimes with fluids, it's easy to get lost in the electronic because it's a little bit different. Just think back to what do we do on the paper form? Did we ever write the rates on our fluid balance chart? Chances are, no. You probably have your hourly infusion forms like we did as well. So your fluid balance, the only thing that's going there is infuse and bolus, okay? Now, if all of these actions up here, they're all actions. So you can, whoopsie, we've already begun our bag. Your site change, this is probably rarely used. So, because really if you're changing the site, you probably need another order and another bag. Yes, as soon as you disconnect, you need another order. But it is there just in case, I don't know, for whatever reason, you did a site change. Infuse amount we've talked about, so that's however much has gone in. Your bolus amount, you might say, okay, well, the doctor told me to give a 250 ml bolus out of that bag or something, or I gave an antibiotic, so I've bolused that. So that will go straight through to your fluid balance chart. Your waste amount. Your waste amount is for any of those, maybe you're getting rid of that bag, but there's still some volume left in that bag, or maybe you got a bit excited and you primed the line and half of it went missing. You can put in your waste there just to keep that bag volume accurate. So just in case someone gets to the end and goes, oh, well, 1,000 went in, if you'd documented your waste there and went, whoopsie, I accidentally lost 100, then it's more accurate because then it will say, well, it's only 900 then that's gone in. Does that make sense? Yeah. Waste is also quite new because even though we have waste on our paper forms, I don't know if you guys are really good out here, but I know we certainly weren't at the PA, no one puts in the waste amount or any of those details. So it's really just, the waste is really just to keep that volume accurate. Okay, so wherever you want to make sure that whoever comes to the end and when they go to put in the 1,000, a whole bag went through, and you know that, you know, there was only actually 500, you might want to put in the waste so it stays accurate. The rate change down the bottom, so if the doctor's gone through and said increase that rate and they've bumped up the order, so now the order up here would say 125, for example, then this will now reflect the 125. You'd come in here and say, okay, well, I've changed the rate so everyone knows. Only when you change that rate will that end bag task move. So remember how I said it doesn't know whether you're stopping and starting? The only time the end bag task moves is when the rate changes, because it's all based off the rate. But again, it's never quite accurate, so don't put too much trust into the times of those end bags. All right, I know it's getting late, and I know people are starting to get a little bit... Fluids is never nice to end on. Let's talk about our end bag task now, okay? So let's say, we'll do the basic end bag task first, and then we'll do what do you do if you don't have an end bag task. So when that bag is finished, and let's say I've gone, okay, well, I'm just going to put in the final 900, okay? So the only way to end, that's a lie, one of the ways to end your bag is you select this end bag task. It looks the same. So the reason it comes up with the same thing is because it gives you a chance to put in your final infuse amount. So if you're even putting in your 100 mils each hour, you want to put in your last 100 mils for the hour before you get rid of that bag, yes? So it gives you an opportunity to put in that final 100 mils. Or if you're one of those other nurses that waits till the bag's finished and you go, okay, well, that's the bag done. There was 1,000 in that, so I can put that there. You can do it that way as well, okay? And that's going to go to the fluid balance chart. If I put in over 10%, the system goes, do you know that that's way more than what was in the bag? It gives you an alert to say, I don't think you've got your volumes right. So if we go back in here and go 2,000, when I go apply, it's going, that's more than what should be in that bag of fluid. Are you sure you've got that right? Okay, so that's also nice as well if people have just gotten a bit excited and haven't looked back and accurately worked out, well, technically there's only 900 mils left in the bag because we've already infused 100, remember? So I'm going to go through and say, okay, I'm getting rid of the bag, there's 900 left, I'll apply that. When I sign that off, because I selected that end bag task and not the pending bag task, because the pending bag task, remember, was back there, I've selected the other one. When I hit refresh, that order now drops to discontinued. There's no more normal saline there in my infusion, okay? It's gone, okay, well, you ended that bag, here it is down the bottom here. Okay? Same thing, if I went, oh, actually I got the volume wrong, there's still like, actually they had only so much went through, you can modify it. Okay? However, never can you make that bag active again. Okay? So you need to be careful when you're going to go and end that bag and you're going, yeah, I'm taking it down, it's done. And then like you've done this first and then you go and go, actually, I'm going to leave it up. That's order's discontinued. If you want to run the rest of that bag, you're going to need a new order. Technically, there's no order for that bag. Does that make sense? So that's why we always say your documentation should be done after. You don't want to be going and discontinuing this from here and then going to the patient and going, oh, actually, there's way more to go, but you've already discontinued it. So now the patient doesn't have an active order for fluids. Does that make sense? So, yeah, just be careful, which is what you should be doing on paper anyway. You'd normally do your patient thing first, go, we get rid of the bag, you're happy, come back, and then actually we don't even do anything on the fluid order form, it's just done. So that gets rid of your end bag tasks. Now, the question around the KVO fluid, because the MAR only shows 24 hours in advance. Okay, so if you've got a bag of fluids running, over 24 hours or over like 5 mils an hour, which means it's going to go even over that, you're not going to see the end bag task, are you, on the MAR? So when you've gone and maybe you've given some boluses and it's finished, and you're like, how do I get rid of this bag of fluid? So there is a way to do that, and I'm not in as a nurse, but I can't be bothered to change, so I'll just quickly order a. I know it confuse people. And I might leave this to some of your senior change champions in the room to go over this, because the first time you see this, I'm probably starting to lose some of you because fluids are a lot, plus we went over all of med. So I know, Amanda, you know what I'm talking about with this, so maybe if once I show this here, if we keep drumming that in.
Keeps coming up for us.
Cool.
Is how do you end that bag?
Good.
Because we take our bags down every morning after our 6 o'clock.
Yep. Oh, okay. So you have a regular point that you always take.
Yeah, give them that.
All or just your KVOs?
KVOs.
Yeah.
And give them that 3 times.
Makes sense.
But I need to know how to end the bag.
Yep, cool.
Can't
Yep.
find it.
Alright, so let's find your. Did we say that right here?
Yeah.
Like quickness initiated, yeah.
Yeah.
I did go into general. We are in a mock domain. I don't know if I just haven't got it built in here. That's annoying. So normally your KVO fluid is in there because.
Scroll on the other bar. That bar. Yeah, no, not that one. Next one.
Oh, I think I'd. Oh, there is another column. I beg your pardon. Oh, and the student becomes the teacher. All right, there we go. There's your bag of sodium chloride, and see how the sentence now says 5 mils an hour, so it's already done for you, so you don't have to do anything. So when I select that one, and it goes, wait a minute, you're a nurse, should you be doing this? And I go, yeah, I'm allowed, back off. And I go in and put my... So this is where you'd put your doctor. So you'd say, you have to do this as a mandatory thing. So you just say whoever the treating clinician is maybe, or if it's a phone order, you'd put in the phone order doctor, so based off whatever situation.
Yeah. Even if you tick nurse initiated no cosign, we still have to put a doctor's name in because it's still sent it off for them to sign it off.
Yeah. If it's a no cosign, if it's a...
Initiated, you need a doctor.
For ED, where you don't co-sign it, so you don't need the doctor, this physician name is always mandatory regardless. It's just one of those hard-coded things. So you still need to put the doctor's name, but you would just put in... Oh, this is an old one. So there is another one under here that just says no cosign. You would just say no cosign required. Yeah, because it has your no-val as a nurse, you're always going to have to put that in, unfortunately. But you'll just say, well, I don't need to send it because I don't normally. So there's another option there that says no cosign required. But for everywhere else where you do need a cosign, you'll make sure you say cosign required. Important to note that your nurse initiated, be careful here if it's common practice for you to send off for cosign, because in the system they're built like... majority of the sites don't ask for a cosign with nurse-initiated orders. So your first instinct is going to be to select this one as at Beaudesert, but if you have a local policy, this is ignoring ED, who are the same, you would select that one. If you're in the rest of the wards where you do need a cosign, I hope I haven't confused everyone, you go cosign required. I got that around the wrong way. Does that make sense? So if you're in ED where you don't need a cosign, you're going to go nurse-initiated, no cosign, which is in line with a lot of the other hospitals. If you're on the wards and you know you need a cosign for any nurse initiated, you're going to say cosign required. Okay? All right, amounts. So see how it's all pre-filled all that for me because it's already in the system as an order sentence. So that just helps us because we're not used to prescribing as nurses. So it is another nice safety thing that they've all been pre-built with all the right things. And you'll notice that it's saying, well, it's going to go over 200 hours because it's 5 mils an hour. So you remember when I said that your MAR only shows 24 hours ahead? So your N-bag task isn't due for 200 hours. So how do we see that? And what do we do with it? Let me show you. All right. So we've got our nurse-initiated sodium chloride here. I'm going to go ahead and begin that bag. No N-bag task. Okay, so let's say that you started running some antibiotics, you used the burette, so that bag's finished a lot earlier than what you thought. Maybe it's even before 6 o'clock, or maybe it's 6 o'clock the next morning and you need to get rid of it, but the N-bag task is not there yet. So, what you need to do, there is another way to do it. If you right-click, and please, I hope this doesn't confuse, this is purely just for your KVO fluids where you don't have an N-bag task. Otherwise, I would strongly suggest you use your N-bag task because that gives you that final opportunity to put in all those final infuse amounts. But if you don't have the N-bag task, you right-click on the order here, you say complete order. You're going to get a warning saying you're about to complete the order because once you do this, you can't get it back. And you go, yeah, it's okay, I know the bag's finished. You'd put in your final infuse amounts, by the way, sorry. I wish I said that. So before you do that, you'd still go into your pending and say, well, 1,000 mils has been through. Yeah? Because when you do it this way, you don't get that opportunity to put in your final infuse amounts.
That's all right. That's what we've been doing.
Yeah, cool.
But I was just making sure that was the right.
I think
another way to end that.
I don't think I actually completed that. Did I? Damn it, yes I did. Sorry, that was my bad. So before you go and right-click and complete order, put in your final infuse amounts to say 1,000 mils because you don't get that final opportunity like you do with the N-bag task. So that way with the right-click on the order is the only way you can get rid of that to KVO fluid. And really you should hopefully only be doing it for the KVO one. Otherwise everything else should have a N-bag task because you shouldn't be running any other fluid that long. Does that make sense? We didn't get to IV sequencing, but that's fine. I'll try and smash it in. Or maybe, do you run any of your own sessions out here, education sessions? One's from me is enough. By the way, we step up to weekly, so you're going to be seeing a lot of me. I'm sorry.
We have the 2 trainers training and then 2 trainers doing.
We sign in sheet.
Oh, man. Yep.